Hello, everybody. This is our presentation on Rift Valley fever. So overall, Rift Valley fever is a very economically important disease, especially to pastoralists in Africa who are nomadic groups of people, think shepherds, that travel with their herds of domesticated animals, and they depend on them for food, sustenance, income. Their entire life is dependent on these animals. So this life is pursued by over 20 million Africans, and it covers over half of the continent's total area, which is a lot. And depending on the climate, they raise different animals. So in drier areas, they have camels and goats, and higher rainfall, they have cattle, sheep, and goats, which are very important to export in the Middle East.
The morbidity rate of the disease, it definitely varies between outbreaks. It's also influenced upon several pre-existing factors, including immunity, pregnancy status, age of the animals. And as far as the age of the animals, it infects the young animals more severely than the adults. In some cases, the illness is widespread and most animals in the herd are affected, which reflects a high morbidity, which is usually seen in a large amount of the cases. In domesticated animals, the infections are most severe in sheep and goats, with abortion rates varying anywhere from 5 to 100%, with the higher end of the range being in the sheep and goats, and then the lower end being in the cattle with less than 10%. And then widespread abortions are also reported sometimes in camels, whereas one outbreak reported a 10% abortion rate, and then the image is just reflecting that data there.
So severity of disease based on economic impact and mortality is about an 8 out of 10. I took into account the abortions that most of the animals, near 100% of the animals will get, and also the acute death where young animals are going to have a higher mortality. Only about 20% of adult animals are actually going to die from this disease. Humans are going to have no symptoms or mild illness, usually at the worst. There is a small percentage that do progress to some hemorrhagic fever, encephalitis, or ocular disease, but you're only going to have death in about 1% of patients. However, the economic importance of this disease cannot be understated.
Like Jesse just said, you can't understate the economic impact of this disease, which is why it's rated a 9 out of 10. After an outbreak, there are significant economic losses, because like I talked about, these animals or these people's entire livelihood, they could lose all of it. There are reductions in trade, which is also bad news since they rely on exports for the most part. So that affects those in Africa and those who are importing the animals in the Middle East. And with an animal outbreak, you have an increased chance of a human outbreak.
As far as the epidemiology of the disease, it is a mosquito-borne vector disease. It is found mainly in the Aedes, Culex, and Anopheles mosquitoes. Due to this, it has a high capacity to spread and a high likelihood of finding the vector introduced in different areas. The most common host range are sheep, cattle, and goats. However, it is also found in water buffalo, camels, monkeys, rodents, cats, dogs, and horses, with more severe disease seen in the newborn puppies and kittens. Like stated before, the rate of spread is a high morbidity. And then the mechanisms of spread in animals, it is the mosquito vector. And in humans, there's the mosquito vector, but also it can be spread aerosolized as well. And this is usually in contact with infected animal tissues, fluids during slaughter, or while assisting delivery. There is the existence of potential vectors, and this is thought to be in either ticks or biting midges, but more research needs to be done in this area. The incubation rate of the disease is on average 1 to 3 days. There has been persistence in the environment, but it has only been shown in research settings right now. It has been shown to survive a few days in protein-rich soil, up to 4 months in neutral or alkaline pH soil, and over 1 hour in aerosolized droplets. Continuing on with the epidemiology, the basics are known, but there's actually still a lot that is incompletely understood about the disease. It is known that the epidemics do occur in existence with the intervals of heavy rainfall, and this is when the mosquito eggs hatch, and then obviously there has to be susceptible animal populations present. In Africa, this occurs in the savanna every 3 to 15 years, so again, there is a widespread time span for that just because they're not quite sure of the epidemiology. Low levels of infection have also been present in livestock and wildlife during interepidemic periods. And some regions have also experienced low-level virus activity only. So due to this, you will see the low-level activity during the rainy season, but you will actually not see any explosive epidemics. As far as immunity and availability of vaccine, it's used in endemic regions in amplifying hosts. The attenuated vaccine does produce a better immunity, but it does add to viral diversity and can cause birth defects and abortions.
So the political implications can be vast, obviously, especially considering that an estimated 90% of farms worldwide are small farms or backyard farms, and that accounts for roughly 80% of the total value of food produced worldwide. And so the import-export laws are regulated by the World Trade Organization, and they take into account recommendations from various groups such as the OIE. And so in the United States, the USDA APHIS Veterinary Service National Import-Export Service regulates the import-export specifically, like I said, for the United States. And what's that mean for a local veterinarian? You can always, according to the USDA, they state specifically that the local veterinarian's role may be limited, but the importance in proper surveillance and fast reporting is obviously very important. And so also taking into account educational efforts such as university studies on the vectors, proper education regarding necropsy and slaughter and milk and meat consumption. And I think that right now, especially in Africa and the sub-Saharan region, that regionally the influences are a lot more severe. And so the World Health Organization and the International Livestock Research Institute, they make local recommendations such as shutting down livestock markets in times of outbreaks and no vaccination in that could be a risk for mechanically vectoring the disease. And of course, educational efforts to the locals, such as not to consume raw milk and blood products, proper PPE when performing a necropsy, etc.
All right, so in terms of prevention, treatment in general, there is none for both animals and people. Supportive care is the only means of working with anyone that has Rift Valley fever. For animals, there's two different vaccines. There's an attenuated live or an inactivated. The live has a better immunity, but it also poses more risks. That includes reassortment with wild types that can contribute to viral diversity, abortions, and birth defects. With the inactivated vaccine, it's less immunogenic, but it also poses risks such as causing viruses in animals if incompletely activated. And it's also not very practical in the field due to the need for multiple doses, unlike the live. For humans, they can be highly susceptible to disease. There's not any vaccines at this time for them. So their main way of dealing with this disease is vector control. So that includes insecticides, use of mosquito nets, covering all skin, so long sleeve shirts and pants, and just full PPE when working with animals. This is a reportable disease, so anyone suspicious of an outbreak should notify their state and federal veterinarian, because quick response is really vital, especially in keeping this from breaking out in Rift Valley fever-free regions. Other ways to control this include disinfection of products used around infected animals and public education so that others are aware of pasteurizing milk and fully cooked meats and things like that to decrease the contraction of this disease.
All right, so Rift Valley fever is not the easiest disease to recognize because it can have a lot of non-specific clinical signs. So that can include like fever, anorexia, weakness, lymphadopathy, diarrhea, regurg, abdominal pain, or some nasal discharge like we already discussed. The very young kids and the lambs with clinical signs rarely survive longer than a few days. So those are guys that are going to be the most severely affected. But the most significant clinical sign, and the one that you probably notice first, is going to be the abortions. The abortion rate can be almost 100%. It's unrelated to the gestation period. So it can be pretty devastating. And then over there is just a list of just some of, if the guys get severe illnesses, what clinical signs you'd see with that. On necropsy, what you're going to recognize, though, is just going to be hepatic necrosis, and that's going to be the most extensive and severe in those young animals. And if you find Rift Valley fever virus in the liver, that's pathognomonic. So you're going to see intranuclear inclusion bodies inside the hepatic cells and necrotic foci. So that is what you're going to want to look for. So obviously, it's easier to recognize this virus on necropsy than it is in real life. You can also see some like jaundice, widespread subacute hemorrhages, ecchymotic lesions on the organs, and just ascites in general. This disease can look like a lot of different diseases, usually because these other diseases also cause hepatomegaly. So the ones that are starred on this giant differential list are the other reportable diseases, so the other big important viruses / diseases that you need to look out for. So that would include Wesselbron disease, blue tongue, heartwater, rinderpest, and pestes. And diagnosing this, like we already discussed, it is a virus, and it's a bunnyvirus, and it's a plevovirus, and it's mosquito-borne, so it's not the easiest to diagnose, especially in live ones, and clinical diagnosis early in the disease is almost impossible, so you're going to have to do some lab tests for definitive. So you can detect the virus in the blood of a febrile animal or the tissue of the deceased, and the tissue or the organ that you're going to want to go to is recommended is the liver because of just that high site of replication from the virus in the liver. You're going to want to do a reverse transcriptase PCR, that's your number one, or you can do virus isolation, but there's a risk to personnel like we already discussed because it's so zoonotic. You can do an ELISA, that's actually what they do when you're trying to diagnose outbreaks in humans, or you can do serologic testing, but you just have to remember that serologic testing can have a cross reaction with other plevoviruses, so you're going to want to do another test to confirm that. But if you've seen basically, you have numerous abortions and high mortalities among young animals, and then you've got some humans that have influenza-like disease, that's pretty indicative of Rift Valley fever.
So the geographic distribution of this disease, typically it's seen through sub-Saharan Africa and it extends a little bit into the Middle East. I gave it a 5 out of 10 because of its geographic location. It's, like I said, mainly in Africa. It's not endemic in any of the other continents at this time. So on the graph here, the blue countries indicate regions that have more endemic issues with this disease, and the green represents countries that will have few cases and periodic outbreaks.
Here are some examples of the outbreaks that we found in the last 20 years. The most recent outbreak is actually occurring currently in Uganda. This outbreak started back in 2016 when a butcher tested positive, and ever since then there has been 10 subsequent outbreaks. As part of the response to the outbreaks, the country has now designated pre-trained response teams. Another recent outbreak was seen in an island in France back in 2019. Given that France is part of the European Union, the early warning and response system was activated. As of today, there's still a ban in exportation of cattle, raw meat, and unpasteurized milk from the island. As well, in 2018, there was an outbreak in Kenya, which traced it back to people consuming meat from dead or sick animals. In this outbreak, there were 26 human cases, included 6 deaths. Here are some more examples. In 2010, in South Africa, there were 489 separate outbreaks, leading to 25 human deaths. Most of them were related to workers of the meat industry. We can also see in 2016, there was an outbreak in Kenya that spread to the United Republic of Tanzania and Somalia. There was another outbreak in 2003 in Egypt. In 2000, there was one in Saudi Arabia and Yemen, which was the first outbreak outside of Africa. And the largest outbreak recorded was in 1997 in Kenya.
So some public health and environmental considerations with this disease. So first off, this is a zoonotic disease, so it's really important to remember that if you do suspect this when you're out on a farm. Humans can become infected through mosquito bites, handling of infected animal tissue. So for example, during slaughter, handling any part of the animal's after birth or assisting with a live birth, any type of veterinary procedure, and then disposal of carcasses can all put you at risk for this disease. The virus will gain access via contact with broken skin, or during slaughter, you can actually inhale some of the aerosolized form of this disease. So you want to make sure you're avoiding any unpasteurized or uncooked meat of infected animals. And to date, no human-to-human transmission has been documented, even in the healthcare workers who treat these patients with this disease when they've taken the appropriate precautions and worn the correct PPE. So during an outbreak, you want to make sure you're educating the general public, and some things you should make sure to emphasize in your communication with them include the safe animal husbandry and slaughtering practices, making sure we're emphasizing good hand hygiene, i.e. wearing gloves and other PPE when handling sick animals and their tissues. You want to encourage people not to consume fresh animal products, most notably raw milk, but also fresh blood and fresh animal tissue. And then also emphasize the importance of protection against mosquito bites. You can use tools such as impregnated mosquito nets, personal insect repellent, light-colored clothing, and then avoid the peak biting times, which is typically the evening.
So the need for research of this disease is relatively significant. Most notably, things like control and eradication of the disease, knowing what vaccinations are available. There are a few that exist, but creating more vaccines to meet the need for containment of the virus and also the reduction of human infections. And with that, the development of an integrated and comprehensive eradication plan for the successful control. Risk factors are also need to be assessed. So like the importance of cryptic small mammal hosts. We've shown that it is possible to infect rats in the lab setting with Rift Valley fever. However, there is no evidence to suggest that they are a significant reservoir. Also, susceptibility of European and North American wildlife, as our non-traditional livestock, such as our alpacas, needs to be better understood. And then also mosquitoes in North America and Europe, if they are capable of transovarian transmission, as well as we need to actually assess the actual virus load in the raw milk and meat products from the infected animals to know if that is a significant route of transmission to humans. Also, not listed here, but just more on the human side, the pathogenesis of the virus in humans, why humans aren't seen to abort during this virus like ruminants are. Also, the genetic factors and comorbidities that in humans that lead to more of the severe diseases such as retinitis and onset of delayed onset encephalitis, and then also if antiviral therapies that cross the blood-brain barrier could be used to treat that manifestation of the disease.
So concerning the CDC's definition, they categorize bioterrorist agents in 3 different categories. Concerning subjects like ease of transmission, is there person-to-person spread?
I didn't quite catch that.
What is the economic impact? Could there be high mortality rates? Does the spread of disease, does it have the ability to cause a lot of public and social panic, and also the availability of the agent? So concerning Rift Valley fever, I think it's pretty clear to see that it poses a lot of different challenges and threats to public safety. It's made the Centers for Food Security and Public Health high consequence and potential bioterrorism agents lists. And I thought it was interesting that they liken Rift Valley fever to West Nile virus in the sense that if it spreads to a new region, it's likely never going to go away. And a lot of that might be due to challenges of vector control and mosquitoes and biting insects. It's obvious it's a zoonotic disease, and people are highly susceptible. And even though the case fatality rate may be low, below 2%, if you consider instances in Kenya where there's an outbreak and there could be up around 200,000 cases, that still could be a significant number of people succumbing to the disease. There are many routes of transmission, especially the transovarial transmission into mosquito eggs, allowing the virus to perpetuate in the environment or exist in the environment in a bit of a dormant state. Many animal species are affected. The severe economic losses due to sheep, cattle, goats, and camels. The virus is also, it can be easily cultured in many different cell lines, and there have been in vitro studies showing the aerosol viability of the virus, and obviously there's no treatment. So in considering all these things, I think it's easy to see that organizations such as Homeland Security and the CDC with emergency preparedness and response and the USDA, that they want to have mechanisms in place to hopefully prevent the spread of this disease to new regions.
So our final score tallied up to be 116 out of 130, which was pretty high. This was a hard disease 2 score because it is kind of subjective scoring, as well as while it doesn't seem to be a worldwide pandemic at the moment, it does have the potential to be and could be economically devastating. So if there's any questions, we'd be happy to answer them if it's possible. And thank you for listening.